Welcome back to blackdoctor.org, where wellness and culture connect. I am Dr. Decoto, board certified podiatrist, and guess what? The new podiatry director for the new Foot Centers of New Jersey and New York. Tell you more about that tea later. I am also the co-founder of Sisters in Podiatry, a Facebook group for Black women across the United States and the Caribbean, and of course, your host for Stepping Forward with Dr. D, your gateway to all things of the lower extremity. I created this monthly show as a comfortable space for people to listen, to learn, and be heard. So grab your favorite beverage. I have my cute mug. Aha! As we welcome our first guest. Our first guest is Dr. Ayanna Scoggin Thomas.
Hi, good evening.
Hi. So tell us about, everybody knows I usually give a whole spiel. I changed it up for season 2. So Dr. Thomas, tell us about yourself.
So I currently live in New Jersey, but I'm originally from St. Louis, Missouri. And I headed out east to New York to begin my training. Initially started in general surgery, and then I switched into anesthesia. I trained at Beth Israel for surgery in the city, which is now closed down, and then did my anesthesia training, both the residency and fellowship at Montefiore in the Bronx.
Boogie down, I was there.
And worked in Staten Island for a number of years until I came over to Jersey to begin work. So I'm here now.
Welcome, welcome. Let me introduce our next guest, Nordia Gibbs. Nordia.
How are you? My name is Nordia Gibbs. I am the COO and founder of Pure Natural Vibes Cannabis Dispensary, located in West Orange, New Jersey. First Black-owned dispensary to open in town. Just my husband and myself, we created our business, Pure Natural Vibes, in 2019 as just a way for, my husband was affected during a deployment in 2012, and he's also a police officer in his regular duties. So he did not want to be addicted to opioids. So we created Pure Natural Vibes as a way to get a more natural, holistic form of pain management to heal his recovery. So we are here, we are open, and I'm really excited to join Dr. D today to talk about it more.
So she already went into it. What are we talking about? Pain. Now I tell folks, you don't need to suffer with pain. I don't know why we think, oh Lord, my foot hurt, my back, you don't need to suffer with pain. There's so many options. And I also have patients who will present and say, I don't want to be on an anti-inflammatory, such as the NSAID classifications, ibuprofen, Motrin prescribed. We're doing Celebrex. We're doing ibuprofen 800. We're doing Mobic, for a host of reasons that we'll get into. We have patients who struggle with chronic pain. What does that look like? Sciatica. Tons of people as we get older, from injuries, weight gain, even pregnancy with epidurals. We have pain, and we have that. And I, as everybody knows, I'm a 5-year cancer survivor. Yes. So of course, I was introduced to natural vibes. Actually, I met Nordia later, but at the time going through treatment, I don't think I'm in the camera well enough, so I'm scoot over. I was excited to find out about other options. So we're going to talk about that. Dr. Jasmine Shelford, who was supposed to be a guest tonight, again, doctors, called to the OR, so she won't be on this tonight, but it's okay. I can cover for her, and we're going to get busy. So first thing I want to talk about, I get patients who, of course, being a podiatrist, I get patients who complain about heel pain, arch pain. I get diabetic patients who complain about burning and tingling in their feet and numbness. I get patients who have post-operative pain. I get patients who have, acute pain and traumatic pain. So I think we're going to divide it up into categories, and I'm going to bounce between the two of you. So Dr. Thomas, Scoggin Thomas, first of all, I know you see patients in terms of pain management. So let's talk about patients that come in for chronic pain. I'll have a patient that will come in and say, I'll give you an episode or a scenario. Mr. Smith comes in and says, I was in a car accident, which is very typical. Years ago, I hit my foot, I broke my foot. They may have been, needed surgery or not needed surgery, regardless of the point. They come in with pain. From my perspective, we always do an x-ray to see what kind of problems they have going on. Is there something like an old fracture, which can cause arthritis? Was there something that they should have fixed that wasn't fixed? Was there something fixed that wasn't fixed correctly? When we figure that out, and we'll give a scenario, I'll keep going with it. Mr. Smith had an old fracture to his metatarsals, which are this part of the foot. And he said that it didn't need surgery as he was told. And now it's 10 years later, he's a little heavier and he's diabetic. And when he walks, he says it hurts like the dickens. It just chronically hurts. Now, from the podiatry perspective, we did x-rays. We will give an injection, a famous injection that some of y'all love or hate, depending. And usually it's a mix of a pain medication to numb the area, like lidocaine or Marcaine, and a steroid to calm it down. We gave Mr. Smith that, and he felt good and he was grooving, and we put him in physical therapy. But Mr. Smith still has pain. When Mr. Smith has pain, I'm usually sending them to a neurologist who looks at the nerves in the body, or I'm sending them to anesthesia pain management. Can you tell us the difference between the two, and then tell me what kind of patients is that a typical patient that you would see?
So, as an anesthesiologist, so what we do, my primary role is to ensure patient safety and comfort during surgical procedures. However, you can get fellowship training to specifically target pain management. Pain management is something that all anesthesiologists are trained to deal with in the acute setting, as well as if you're in a hospital setting. Sometimes you're dealing with chronic patients, and a lot of our surgeries that we have to deal with are patients that are coming in for procedures or surgeries that have chronic pain. So you have to treat their acute pain on top of their chronic pain. The pain management aspect can look at whether it's neuropathic pain, which is something suffering from nerve damage, versus like a nociceptive pain from tissue trauma. So breaking that down,
please break that down, because somebody said nocia, who?
So it's tissue damage. It feels like more sharp aching pain versus your neuropathic pain, which would result from more something like it would feel more like burning, shooting, electrical type of sensations from nerve damage, whether it's peripheral or from a back injury, so spinal injury. So I deliver anesthesia mainly. I work for a group who has both specific pain management doctors who can deliver pain management in regards to whether it's by oral medications or by injections or spinal stimulators, depending on the level of the pain and what the patient has tried. As you said before, Dr. D, about trying physical therapy, all of the non-opioid medication type of approaches first, right? But it also sometimes needs to be combined with oral medications, and we try to avoid having to go down the opioid route because we want to avoid.
And why do we try to do that? Because, I'm sure patients who are people who are listening are like, my doctor has me, Percocet works for me, or my doctor has me on long. What are some of the reasons that we don't want to keep patients on opioids for?
Well, we know that this country has suffered, from people becoming addicted to these medications, and the longer you use it, these type of opioid medications will require higher and higher doses because there's a tolerance that builds up. And so, and then that looks like a total different picture of addiction and function in life, and with your family. So it's putting a Band-Aid really on a situation rather than trying to find ways that can allow you to be functional, have a better quality of life, not be so drowsy, not have the GI symptoms of constipation and things like that. To be high functioning, but having your pain, modified. So it's very key.
Good answer. And I mean, the other things, that we're going to go to Nordy in a minute, people have to worry about is that most pain medications can be processed in your liver or your kidneys. And a lot of times, African Americans are at higher risk for kidney dysfunction. And a lot of times we see that in our diabetic patients, and we see that in our high blood pressure patients. So a lot of times we're doing labs on you and we're like, and we see it's creeping up. So if you're having pain and now we're keeping you on these meds, it's just pushing, lugging through your liver and lugging through your kidney, which is making the kidney do backflips, somersaults, and a split to try to get it processed through your system. So Nordia, Pure Vibes. I love it because, everybody's thinking, pass, did that cheap on the left hand, and I tell people it's just not, it's not just smoking, a blunt, So tell us, when someone says, you know what, I've seen Dr. Scoggin Thomas, and you know what, yes, I've been on pain meds, but I really would like to try something alternative, something natural. But I'm so terrified. I'm not a drug user with this marijuana business, and they want to find an alternative. Tell us about Pure Natural Vibes. Tell us why you see people switch to cannabis, and what is cannabis? Because everybody thinks it's just getting high, which we know is not the case.
Right. So it's really not. There are so many different cannabinoids in the cannabis plants. The main is the THC and the CBD, which most people have heard of. The THC cannabinoid, it is what gets people high per se, but it is not just that. You have CBD, you have CBG, you have CBN, all these additional cannabinoids from the plant that will provide relief of some sort without the psychoactive effect. So exactly. For someone coming in looking for an alternative to pain, they don't necessarily even have to smoke. They can take a gummy. We have topicals, we have tinctures, we have...
I like that word gummy. We're going to get into that in a second.
We have creams and balms and different methods outside of smoking to find some form of relief. And I'm sure the Band-Aid word came up from you, Dr. D. You're not just putting a Band-Aid on it. You still want to find out what is really the core issue of your pain. But, there is an alternative rather than taking opioids consistently to manage that while you're figuring out what's going on. Cannabis could be a solution for some.
I think it's great. Thank you for Fred Currier logging on. Thank you so much. We appreciate it. So tell us, let's go back into marijuana in terms of the medicinal uses. I know in the state of New York and New Jersey, it's illegal, and not in every state is it. You can get a prescription for it, and tell us what type of... Well, first, I'm going to ask that question to Dr. Scoggin Thomas and then get back to you. Dr. Scoggin Thomas, what type of prescriptions are your patients that are come for a prescription, regardless if your state is, pro marijuana or not, but if they're coming to you for a prescription, or you seeing that, what kind of things are they coming for? Like, is it trauma? Tell us what patients get prescriptions for.
So of course they're not coming to me and looking for me to prescribe them Tylenol. They've tried that. They want something a little more powerful. And so, in regards to your non-opioid drugs, we're looking at things like naproxen. You mentioned before Celebrex. Celebrex is great NSAID for people that have the GI issues.
Like when GI issues like acid reflux.
Exactly.
And anybody knows when you get that that acid reflux. You're like, no, ma'am, that bed needs to be up, or you're looking for something.
Exactly. And then for like, if their pain is more neuropathic, as we discussed before, you're looking at things like Neurontin and Lyrica, things that can target that more neuropathic type of pain. You can also sometimes layer it with antidepressants, because a lot of times, sometimes there's other issues going on that can create pain.
So talk about that. Why would, I know people like antidepressant? Why would you give me an antidepressant? I'm fine. Why would you give? And what is an example of one?
Amitriptyline is one that is greatly used in conjunction with other things, because we talk about the mental, mind over matter. All of that has an effect on our body and can create what you feel is actual pain. And so when we're trying to come up with things, and first, we're trying things step by step, not all at once. We're going to lay all of this on. We're going to see if this works. And then once we get to a point where we've tried this at a certain dose, then we can add a layer and say, let's try this and add this on. And a lot of times it really works. People are on Lyrica, and things like that. And amitriptyline is a common one that we prescribe as well. But Zoloft, it really is an additive effect, because, and it kind of goes hand in hand. It's like with the chicken or the egg, because you're in chronic pain. Are you depressed, or is it depression that causes chronic pain? So it's a kind of dual edge there. So you can layer it with treating that, and that off time helps as well. Again, some feel like muscle relaxants can also be another type of drug that can add in and help. Outside of, there's a few patients that we will then have tried things, and then we have to go to the opioid route, and that's more like a tramadol, or even there's a new one out, Nucynta is another one. And those are great in regards to, Nucynta is kind of great because it doesn't have such the GI effects of the constipation. But there's different ones that we can try. But again, we try to stay away from like the codeines and the Percocets, which are more addictive. We try to drugs that are partial opioid agonists, like bupropion. I get it. That gets a tongue tied, but there's other ones that are partial agonists that can really help. But again, we try to steer away from that. And when those non-opioids don't work, we also can try things such as what you stated before, giving injections to see if that off time helps.
So I've given injections for patients who may have pain initially after surgery. Sometimes they have, that's acute pain. And so I will, if they're like my pain, pain scale from 1 to 10, and if their pain is, over 5 or 6, I'll give them a block. And I would say that 9 out of 10 times, and the block means that we inject you with medication to numb and dull down that nerve that's doing and most patients do well with it, where I don't need to up their medication per se, but it might be that we may change the, instead of maybe one Tylenol with codeine, which is what I like to stick to, maybe what, as the patient was on it once every 6 hours, we may say take it 1 every 4 hours if the pain is that much. But I find that with acute pain, it's usually due to something, some trauma, whether it's surgically induced or the patient, life happens, you fell, you broke something, what have you. So my question was to you, Ayana, would you ever refer to Pure Natural Vibes? Because again, if I have a patient, I have a good friend of mine who actually had a car accident, was hit, and had to see pain management. And of course, she got this, we'll talk about some of the treatments that you do. And she was, like, I don't want to take all this stuff. So she wanted to use, medicinal marijuana. Her neurologist, I believe, prescribed it. So the patients that you're seeing, let's go back to Nordia. who is a typical man or woman coming into your office? I mean, into your practice. I'm so sorry, it's office that I have
I
into
know.
your establishment. Who are you seeing? What is the type of patient that we know, but what are the type of client that you're getting?
Right. So for us, it's customers. Um,
We can't say it's.
I know,
I know.
patients. We're saying.
With the lingo, I totally get. So we are a recreational dispensary. There are legal medical dispensaries in the state of New Jersey. I have seen a prescription from a medical medical doctor, and it's literally try a gummy that will increase your appetite. So there's really no specific. You listed a bunch of medications, Dr. Thomas, and
Yeah.
it's not the same at all because everyone reacts different to cannabis.
Absolutely.
And while some may find relief with just like a regular indica gummy, someone may need an RSO. And I don't expect the medical professionals to really understand all the different types of brands and processing that the THC and the CBD and CBN will go through to find a relief for that patient, because we're not there yet with just how patients really interact with cannabis.
Mm-hmm.
So a normal person will walk in and they'll say, I can't sleep, I have insomnia and I don't want to keep taking my sleep medication. What do you have to help me sleep? So we do know, like the CBN cannabinoid, it kind of mimics a sedative. So you can have a gummy with a CBN in it to kind of help relax you and kind of, basically put you to sleep and keep you asleep for an X amount of time. But it's definitely an alternative. And we have a few different options for people that are coming in with a variety of different questions, just because they don't want to do prescription all the time.
What are the questions that they're coming in with? What are they asking you?
So I do have one customer right now, and we're kind of exploring. She said, I don't want to smoke. She said, my doctors have given me everything, and they have suggested I try, cannabis. So now we're exploring topicals with her. We're exploring the different, gummies, the ones with the RSO, which is the Rick Simpson oil, which is a little more concentrated form of the cannabis oil, versus like a regular indica, a mix of the CBN and the CBD and the THC together in that gummy. Like it does a lot, when you can try something that works for you, that you don't have to keep refilling a prescription for. Like it really makes a night and day difference for some.
I'll tell you, I've seen at least about 50% of the patients that come in for pain injections to be on some type of cannabis. So, Dr. D, you were asking whether, I would recommend. I mean, I myself recently had an injury where I had to have surgery for a fracture in my wrist, and the pain was the worst pain I've ever felt after surgery. And they gave me prescribed me Percocet for that acute after, a week or so after my surgery. And opioids, codeines, that's a typical prescription for a short period of time. Try to get you past that initial trauma to your tissues. But after that, I had such problems sleeping. It was just such discomfort, such pain, that I myself went to a dispensary. And I came in, I was like, look, I'm not trying to get high. I just need help with pain so that I can sleep at night. And I was like, tell me what you got. And he broke it down just like you and told me, look, this is this strain, the CBD, this would work best for you. And I witnessed it. It really did help me. I just needed it for that short period of time till I got out of the cast and got some more mobility. Now I'm fine. I don't need it. But it definitely helped me through that period without having, because I didn't want to keep taking the NSAIDs. I didn't want to have, develop ulcers, because I was taking that on my stomach. I didn't want to, add trauma to my liver from taking too much Tylenol. So I was like, I just need a little something, just ease. And it was a perfect recipe for me. So I absolutely do believe that can be of great help for patients in acute and chronic.
So Nordia, tell us the difference between like topicals, because again, people are still thinking is smoking this weed, and I'm like, that's not it. Tell us the difference between topicals. Tell us the difference between gummy, and tell us the difference between an actual roll-up and why.
Okay, so you have the cannabis flower itself. From the flower, you can extract the oil, and that oil can be made into different forms of cannabis. So whether that is, let's start with a tincture maybe, that is the concentrated liquid that's kind of in a dropper with a droplet in a bottle. It is probably the most precise form of dosing because you kind of get to measure the amount of liquid cannabis that you're putting into your body. And with the tinctures, it's almost an immediate onset of relief because it goes into your bloodstream versus an edible, which has to go down through your digestive system first, and then you'll feel the onset. So usually edible is the oil that's made into a gummy or a cookie or brownie or any other edible form of cannabis. And that takes a process too. So my time frame might be different than you, Dr. D, because our digestive system work completely different. Mm-hmm. My 5 milligram gummy might not do much for you, Dr. D. You may need 10 or you may need 2.5. So there is, quite a difference in the forms. We talked about the tinctures and the edible. We could do the topicals, almost like a lotion. So this, you can't get high from applying lotion. Let me put that out there because it doesn't penetrate the skin deep enough to go into the bloodstream for you mm-hmm. to get high. But it does form a layer of comfort in that area. So like a sore muscle, arthritis, anything that hurts that a topical would usually help with, you can get the benefits from like a CBD THC topical mix in that sense. Your joint would be your flower that's grinded down and rolled into a joint or a bud that people would put in their bongs to smoke. Most people prefer smoking because of the immediate relief. Mm-hmm. It is probably like you're not manipulating the flower when you smoke it. So it is the purest form of getting what you need from the flower. You're getting all the trichomes, you're getting all the glorious. That
was a big word. Was a tri who?
Oh, okay. So it's the trichomes are like the little crystallized things on the plant that has all the cannabinoids in it. So your CBD, your THC, your CBN, everything that the flower has to offer, you can find on that trichome. So when you smoke the whole plant, you get all of that benefit from, rather than, pulling apart the oil to do something else with. So most people do choose to smoke because you get the most benefit from smoking the plant.
So let me ask a question. First, we're going to give a shout out to Michelle Reynolds West. Thank you for watching. We appreciate it. Nancy Marie Sunshine, we see you too. Someone had a question. Thank you, Lenora. I think McKizak, I apologize. So somebody asked, can it show up in a drug test? So if you're telling me, hey, I've seen Dr. Scoggin Thomas. I saw Dr. Decoto. I had a chronic break. I broke my foot, eons ago. I've gained weight. I'm diabetic. It hurts. Dr. Scoggin Thomas, she gave me, anti-inflammatories. I told that didn't work because Dr. Decoto gave it to me and gave me a block or an injection. I even got Percocet from Dr. Scoggin Thomas and a muscle relaxant. And you know what? I don't like that feeling. I have kids. I want to make sure I'm okay. You know, she recommended maybe try cannabinoids. So I came to you, but you know what? I don't need to get fired from my job in this economy. So what can I take that will not show up in a drug test?
If it has THC in it, it will show up in the test. They will test. If they testing for marijuana and it has THC, it will show up in the blood test.
Can that be in the topicals as well? Does the topicals have the THC in it?
No.
Okay.
It will not. Topicals are like lotion, and as they said, it's not penetrating the skin deep enough to go into your bloodstream, which means it will not show up in a blood test because you're not ingesting it.
Understood. Okay, great. Because you know, people, you know, are always concerned. So if I was to prescribe a patient, if you were, well, I'm not prescribing, but if the patient is coming to you and they're saying, hey, you know, I want to try a cannabinoid, will they get relief? Will it just be a matter of it taking longer to get relief using a topical versus a gummy or versus smoking something?
So topicals are almost immediate because again, you're applying it directly to the skin. So
the largest organ in the body.
Right. So what you want to do is make sure that it is moist. You're something warm, like a warm rag, prior to applying, so your pores are open to intercept the cannabinoids that's coming from the topical to provide the relief that you need. So it's almost immediate for the topicals. And as I said, with the tincture and the smoking, because it goes into your bloodstream, that's also pretty immediate. It's your gummies that has to go through your digestive system. So that takes a little while for your body to break that down, for you to feel the results from eating that gummy. This is why they say you wait 2 hours. You don't just eat another.
Don't do it again.
Because you haven't felt the first one.
So if someone was to, let's just say, okay, would you, I don't know if I should say recommend, because I don't want to say that. Would you say that your recommendations when someone, Mr. Smith, is coming to you and you're and saying, hey, I have pain, what questions would you ask him? Because he's trying to keep his job, but he wants not to use Percocet either because he can't keep his job being high and sleepy because he would get in an accident. So what would you tell him, you know, to do in terms of which option is his better option to choose? He has a 9 to 5.
Now, is this question for Dr. Thomas?
I know, right?
Both these questions are both for you. Dr. Thomas, you can go first.
So, again, it would be, you're trying to function. I'm not trying to prescribe you the opioids or even the muscle relaxants, which can really make people feel very drained and tired. It would be, you know, doing some therapy, some topical things that could possibly work as well. It depends on the level of pain and this patient's function and what they've used before. So you're going to ask the question of what have you been using? What, you know, has worked and what hasn't worked? And then from there, we can go into talking about the antidepressants that can work as well and have you function. But, you know, again, I would steer away from having to take, you know, the opioids. So, which is why people come in a lot of times. And the oxy. A lot of times people come in for invasive procedures such as your steroid injections to be able to function without having to be on medication. You know,
so let's talk about that. I have a good friend. This is perfect. I'm going to see her later. I mentioned she was in a car accident and hit. So she did steroid injections. We'll do part 1 to where she is now. Tell us, what does that look like? Because from the perspective of the lower extremity, if you come into me and it's acute pain or even a chronic pain, we'll give you a local injection in the area where it hurts, where the nerve is running. Is there a difference that you would do for someone? We're going to stick with the leg because this is what we do. Would you do anything different in terms of location? When you say, I'm going to give them an injection, a pain injection, what does that look like?
So from my standpoint, what the injections are usually, you know, in the epidural space. So it's in your back. So you're getting, depending on where your pain is originating from, can be in your neck if you're having, you know, pains going down your arm, or you're having sciatic pain, you know, going down one of your legs. It's it's been narrowed down that this is neuropathic pain that is coming from your spine. Okay, you have some type of herniation or compression or some or bulging.
Slip disc, all those back issues. Yes,
exactly. That can cause that. We also do knee injections directly into the knee or the hip. So those are, like I said, a mix of the a local anesthetic and a steroid. So you would come into the facility. It can be tolerated under local anesthesia where you're awake, but you can also get IV sedation, or you don't want to feel even the little pinch of local anesthesia. It's no more than usually a 10-minute procedure. You said you don't even want to feel.
Nope. And I do surgeries all, as well, but nope.
Knock you out.
No, I'm a tough one. I'd be okay.
and it's fine. It's a 10-minute, no more than usually a 10-minute procedure. And you sometimes have to have several of those to really see an effect. People can even get ablations where there's radio frequency or going in to kind of burn certain
areas. Hold on. We're going to get to that. I'm going to bring you back.
Sorry.
So now
after
do that because Ayana's a friend. So now, so my friend did do that. She did have injections. She got some relief. She, in her back, she was doing physical therapy, and it just got to the point where it didn't work anymore. So she ended up getting, you used a big word. People like radio, what we listen to the radio for? She had an ablation today. Can you tell us what an ablation is? Well, not today. She had it Friday. What an ablation is, and tell us what radio frequency is for people who are looking at you like, what is she talking about?
So basically you're sending electrical stimulation, and it's almost like a burning of around the root nerves.
And this is the ablation you're discussing?
The ablation, yeah. Okay. That have been targeted to be the areas that are affecting, and that is to permanently, hopefully, alleviate the pain. Sometimes that works, and sometimes people have to get it again, but it's great when it works because people are like, oh my God, I had one side done, my left side. It's amazing. Now I need the other side done. And it can work for a while. And then again, it depends on, if the pain is still there. And a lot of times people are trying to avoid surgery. They don't want to have back surgery.
Right.
They don't want, so they're like, can we do anything to get away from having to have surgery? And these injections really do help. Sometimes, people end up having the surgery and are having pain and have to come back to get injections, or even get elevated to having spinal cord stimulators, a device that's implanted similar to almost like a pacemaker, that will send electrical interference to your nerve so that by the time it reaches the brain, it's not computing as pain. And that can be effective, for 50 to 70% of patients. But the nice thing about that is that it's tested before it's permanently implanted. Test it for 5 or 7 days. You have it temporarily to see if it works. And if it is solid and it works, then the implant happens. And at year 5, there may be a decrease in the effectiveness a bit, but usually typical people have remarkable relief of pain. Now, sometimes you have to also understand what expectations are too. Is your pain better? Are you more functional? Because it may not totally ablate, all of the pain, but has it rendered you more functional? The pain is now a lot more tolerable. It's understanding what success is, in regards to trying to manage pain, and understanding that, there, again, it's a Band-Aid because there still is a problem, right? That disc is still bulging, or that screw is in your spine and it's still, going to rub. But can we, since you want to avoid surgery, can we manage your pain, and can you function in life?
So you're right. And some of the things with the lower extremity is, which we're focused on clearly. As I said, my good girlfriend was in a car accident. But one of the things we realize is for the joint or the foot, is that foot or ankle in the right position? If that foot pronates, meaning you roll in, you can see wear pattern on the inside, then it's pulling abnormally on some of the tendons that should not be pulling, and the bone may not be in the right position. And if you supinate, roll out, is these bones, which should look like this, is one sitting lower than the other. So sometimes it's positions in the foot and ankle where tendon and or bone are just not in the right position, or the tendon ligaments are just not as strong anymore. You know, you've been playing cheerleading back in the day, you were dancing hip hop, you know, dropping it like a sock, you can't drop it anymore. And and those ligaments are like, good Lord, we're on the last thread, you know, and you might need the surgical procedure to fix it. So that's number one, if you have a problem in the lower extremity. Number two is if you've had the surgery and it's not successful for a reason. I'm going to go back to Nordia. So, and I have patients who, again, I try, you know, the DEA in the United States is, you know, you can prescribe 5 days of narcotics and then you're reevaluated. And it goes through a whole database. And I agree with that. And I always look for complementary therapy. So for my patients, if it's acute, I'll use a fracture. The patient is non-weight bearing, meaning that they're on crutches. And any of my patients listening are like, oh, yes, Dr. Dakota. Because I'm like, don't put any weight on it. They're either in a boot or they're in a half cast, known as a posterior splint, or they're in a cast that's been cut around it to allow it to open and close for swelling. Then they go from that to partial weight bearing, toe touching, or into a boot. And we go accordingly. So I usually we start with narcotics. Sometimes depending on how aggressive it is, we might add on medication, gabapentin, and an anti-inflammatory. I love Toradol if they can tolerate it. Toradol to me is one of the best medications out there with that, because it will not. Some people think the narcotic kills the pain, is the anti-inflammatories, especially if I cut into it swollen, it brings it down. Toradol injectable is beautiful.
Especially in those acute times, absolutely.
Yep. I have anesthesia. I tell my anesthesiologist, patients clear and healthy, give them now. So as they're leaving the operating room, they're getting that, so that their need for the narcotic reduces significantly.
Exactly.
So that's that. But I have patients who are like, okay, I done did my 5 days, and guess what? I'm sick of the ibuprofen, and they're gonna go back to passing the Dutchie on the left-hand side. So I'll have patients. So what's sending in me? Trinidad.
Exactly.
No, where are you from?
I'm Jamaican.
That's all right. I have a Jamaican godfather, but I've had patients. We don't give the licensure for, especially in New York and New Jersey now, it's legal, but podiatrists don't give the licensure for narcotics. I'm sorry, for medical marijuana. Yeah. But now that it's legal, we have patients ask us, and I'm always telling them to go into a dispensary with somebody who's well-versed like yourself, Nordia, to say, hey, and I even talk to the patients, what are you looking for? What type of job do you have? Which I think it's a doctor's responsibility, because I think, you don't want somebody to have a positive test and now you have to jump in at work to tell them, wait a minute, hold on, this is why. And I love that there's topicals. That was the best thing I think that came out. And I tell patients, topicals might be an answer for you, but don't expect you to just, Jesus lays hands. I tell them it may not just happen like this. You have to be patient with it. You might have to try the right strain. What may work for Dr. Scoggin Thomas may not work for Dr. Dakota, because we're different people and how we metabolize. So back to you, Nordia. So now you have Mr. Smith and said, okay, like I fractured my foot. It's hurting. I don't want to take Motrin, because guess what? My doctor told me that my liver enzymes for my labs were elevated. So you're going to give me a topical. Tell us what topicals look like. Are there different strains? How does it come in a roll-on? Because, people are like, I don't know what a topical, it could be a lotion. What is it, a balm? Give us an idea of what they're getting counseled on and going home with.
It's really all of the above. They have it in a roll-on form. They have it
like
in a
deodorant?
balm. Yeah. Yeah. It's like, just roll it on the area. They have it in a pump bottle lotion form. They have it in a glass jar. It's a salve. They kind of put it in an isolated area that's needed. But New Jersey has their standard of the strength. So most of your topicals, edibles, tinctures will come at 100 milligrams of THC content. They don't count the added cannabinoids because they're not psychoactive. So if you have like a CBD THC mix, which I recommend 100%, because the CBD is anti-inflammatory. So I know you mentioned that sometimes that helps to suppress what's going on inside to even help with the pain. So when you come, you don't always have to get a THC gummy. You could just get CBD, because that helps with the anti-inflammatory inside your body that's happening. And you can take as many as those as you wish, because you're not getting high from those. So I'm glad you brought that up. Dr.
Absolutely, because people think it's just THC. I'm high. I remember when I went through cancer and I told my mother I got my marijuana card. And you know my mother, Ayana. She's like, you got what? I said, I'm not. What do you think I'm in the house? Like, no, And unfortunately for me, it didn't work, and I was too chicken to go back to find a different strain. If anything, I was already, interviewing them like a residency. Like, listen, just like you, I'm a physician. I'm this, I'm that. Listen. And they were very patient. Most facilities are wonderful, especially I think when doctors or medical professionals come in, because they know that we know a lot, and we want to make sure that there's no issues, as anybody does. But I think that, for me, I was just so nervous, like, oh my God, did it work? I'm in pain. Oh my God, and I should have, I think if I would have had a relationship like I have with you, Nordy, I would have came back and let you just sit me down and been like, okay, these are options, even the topicals, which I don't think that was pushed towards me from what I remember. Granted, it's been 5 years, but I don't remember that being pushed towards me. And I probably would have been more inclined to do that because I like the idea of CBD. CBD is infused in everything now, from CBD infused tea to CBD infused lotion. Even you're finding it everywhere because of the anti-inflammatory properties. And it's bypassing going through the liver versus the skin, which is a nice way of use for pain meds, particularly if you're trying to protect that liver. Again, when a lot of women, with menstrual cycles will take Tylenol. People think Tylenol, but you only take a gram a day. Once you exceed that, your liver is doing the cha-cha slide, and it's like, no. And then you might have problems. If you have, and then sometimes these meds, as we see, cancer meds, and even Motrin and I'm sorry, Tylenol and things of that nature that process through your liver, other medications like terbinafine for fungus. So if you have all this stuff in your body, that's why we check your labs. I know a lot of times people are like, well, why do I need labs from you? And I'm like, because we don't want to blow out your liver. Okay. You don't need to go into cirrhosis, drug-induced cirrhosis, because you are on all these medications. So having the cannabinoids, especially CBD, is a wonderful, 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 wonderful option. So back to Dr. Scoggin Thomas. So yes, my good friend had the ablation. Let's talk about complementary, because I think that from the patient that we use, I fix the foot. I'm going to make sure the foot's in the right position. I'm going to make sure the patient wears a custom insert after to keep their foot where they're supposed to be. They're still having pain. They come to see you. You recommend, anything from, well, patients want Percocet, okay, maybe a muscle relaxant, maybe amitriptyline. I've given gabapentin. Patient might have, maybe there was a nerve that we didn't realize was so messed up, and they have sciatica, which now, because they're walking like this from the boot, it's just flaring its ugly head. We both chit chat, which is what good doctors do, and recommend Mr. Smith to go into physical therapy. Mr. Smith is like, I'm still having pain and I need to sleep. I think that most doctors would say, hey, at least in states like, New York and Jersey, I'll use those too. Let's go send you to Pure Natural Vibes. And what type of are you forming relationships, Nordia, with medical providers? What does that look like? Tell us, because I think people think there's going to the weed shop. This is not the weed man around the corner that a lot of people have that psyche of thinking that is not the case. I mean, I've been to your establishment. It's absolutely gorgeous. I was like, oh my God, this is okay. There's security. So you go act the fool, you'll be escorted out. Have to show ID. You won't even get let in for most of these. But these are not Nordia's practices. These is government practices. Right. So Nordia, when you have, do you get like maybe notes from doctors, or do you speak to doctors who might be saying, I have a patient that might just be a good, candidate? Tell us what that looks like.
So funny enough, we're in a medical building.
That's right. And I saw Dr. Owls, shout out to him the other day.
And we do have a couple of doctors upstairs, one of which she is a medical cannabis provider. So she is licensed with the state of New Jersey to participate in the medical cannabis program. So my conversations with her not all of her patients actually want to go through the process of obtaining a medical cannabis ID card, because at that point, all your information is in the system. And being that we are in a recreational state, there are patients of hers that just wants to use it on a recreational basis instead of taking Tylenol, right? So our conversations are very similar to any other conversations that a medical patient would walk in to another medical dispensary and have with that particular care provider. That's why I've seen those notes, like on the prescription pad. She's not eating. She needs something to help her, get her appetite back. So she needs to have something that gives her the munchies. Because she needs to eat. And she's lost her appetite. We don't know why. We're running some tests, but in the meantime, let's get her munchies back, So at that point, we have a bunch of gummies that could do that. If you don't want to smoke, we have particular strain like the wedding cake. Whether that comes in a cart or a gummy or flour, that is known for increasing appetite in like patients that use that particular strain. So these are the conversations but you just have to know your products too. You just can't, because again, not everyone is built the same. Dr. D's 5 milligram might be 10 milligrams for me. So it's a matter of, but the microdosing is so important, because as Dr. Thomas alluded to earlier, you're not going to find total relief all the time, but you still want to be functional. You don't want to sit in pain all day. So maybe a 5 milligram gummy
can get you through.
Absolutely. You don't need 10. You don't need to take the whole thing, because you're going to be sitting on the couch for like 4 hours because you're so tired. we don't want that. So it's, well, again, you can go through the process with the state to have your medical ID card, but I do find that a lot of conversations that I do have, they just don't want to be in the system identified that way. We are a privacy state. Whatever my customers buy, it's not sent over to the state. There are just customer in my database with a date of birth. That's it. There's no trace of addresses, phone numbers, names, none of that. And that's how they like to keep it. So it's a pretty similar journey with having a conversation with someone that's just looking to sleep at night versus someone that they've tried every other over-the-counter and every other prescription that their doctors have given them, and they just want to break from that, and they just want to try something else. So
that's great.
Yeah.
What I would like you to do, each one of you, Dr. We'll continue with Nordia. Give us the 3 top reasons people come in to Pure Natural Vibes. What are you seeing that they're complaining for? I need this because I suffer with. Go for it.
Well, one is a lot of anxiety. So they need to I just need to relax a little bit. I can't sleep and I have pain. Those are my top 3.
Great. Dr. Scoggin Thomas, patients coming to you, that are coming from specialties, orthopodiatry, primary care doctors, cancer patients like myself in the past, in the same short time, tell us the 3 top reasons, the 3 types of, the 3 top patients complaints that are coming to you.
Usually a lot of motor vehicle accidents like your friends. So a lot of chronic back, chronic neck pain. We even see patients with migraines because spinal injections can actually help with migraines as well. But it's usually the back, the neck, or the lower back that people are suffering from.
Absolutely. I mean, in terms of myself for podiatry, we're seeing patients with chronic pain, heel pain, the tendinitises, the arch pain, fractures, and trauma. Those are the big ones. And then, the bunions and hammer toes, with joints that are not in the right position, things of that nature. And diabetic neuropathy, obviously patients who are having burning and tingling in their feet, and they're like, I can't sleep. And once you lose sleep, that sets off everything else in the cascade. Lack of work, you might start developing your hypertension or worsening those symptoms. diabetes because you're not sleeping, so maybe you don't eat as well or at all, or overeating to compensate for it. So pain is something that we absolutely have to manage. It's been a pleasure having you lovely ladies on tonight. I love conversations that educate the community. So I'm going to start with Nordia Gibbs. Tell us who you are again and where can we find you who are interested in your lovely establishment.
Yes, I'm Nordia Gibbs. I am COO and co-founder of Pure Natural Vibes. We are located at 470 Prospect Avenue in West Orange, and I can't wait to meet you.
West Orange, give me a plug. Dr. Scoggin Thomas, let us know who you are and where can we find you.
I am Ayana Scoggin Thomas. I work with Union Anesthesia Associates and Pain Management Group, and we currently deliver services at a couple of different locations. One is Pleasantdale Ambulatory Care Center in West Orange, and the other one is the Indus Surgery Center in Union. So find me there.
Thank you. And of course, as I mentioned, I'm Dr. Cordaide Cotto. My umbrella is Talks with Dr. D. You can find me on Instagram. You can find me on Facebook. You can find me on LinkedIn. Talks with Dr. D is the umbrella organization for 3 pillars, which is Stepping Forward with Dr. D, as you see today, where we educate the community on all things of the lower extremity, podiatry. We also have coming up our annual Sisters on the Vineyard, which is my nonprofit. This year, our keynote being Tamika Mallory and our guest speaker being Malik Yoba, with multiple board certified physicians and one of the top financial gurus in the biz to educate your mind and your body while being in a solstice space on the vineyard, August 12th. And lastly, Dr. D also has Talks for Dr. D Breast Cancer, which supports breast cancer patients and their family going through the process through advocacy. You can find me on my website in the previous links. And yes, Dr. D is back in Essex County practicing.
Yay!
I am not accepting any new patients yet, so don't come bombard me. There will be information on my social media where I'm accepting all outside patients. I appreciate the support over the years, and baby, I'm back. Okay, so all of your bunions and hammer toes and heel pains and all those types of things we discussed, I'm absolutely here, and bilingual for your Spanish-speaking patients. Thank you so much, Dr. Ayana Scoggin Thomas.
Pleasure.
Thank you so much, Nordia Gibbs from Pure Natural Vibes. I feel like I should be playing a reggae right now. Like,
I know, on the way on the outro.
or a little soca on the outro, exactly. I thank you, everyone who's tuned in. We are always on the first Wednesday monthly from 7 to 8 p.m. Eastern Time. This is recorded where you can find it on blackdoctor.org or on my YouTube channel. Again, everything at Talks with Dr. D, and that's TALKS, and I'll put it in here for you, with DRD. Thank you for those who supported tonight. I know this was a Jersey connection. Sometimes we had West Coast last time. Our next show will be the first week of June. Ooh, and we're talking about running. Running is big. We have great organizations called Black Men Run and Black Women Run and Black Girls Run. And it's just amazing. And to see that people are taking their health seriously, but sometimes we get, unfortunately, the pains and strains. So we're going to have a robust conversation about that, and you'll see the advertisement. And thank you so much for supporting us. This is Talks for Dr. D, Pain, Season 2, Episode 2, signing off. Wave to the camera. Say bye, everybody.
Good night.